diagnosing or accurately diagnosing a spine problem is actually very complicated. Many patients will come into the doctor and say that they have back pain. Just to be clear, if you look at the back of my head, the back of my neck, the back of my shoulders, it's all part of my back. And people, when they say back pain, most physicians only think about the low lumbar spine, the lower back. And so somebody who has actually pain between their shoulder blades, that could actually be a symptom of an upper spine problem. So one of the most unusual things that we find and often get diagnosed a little bit late is other parts of the spine that can become symptomatic. And this includes the neck and the shoulders. Another unusual sign or symptom of a spine problem is actually pain behind the ears, pain behind the head, headaches. What is not so commonly known or commonly seen is some of the nerves from the neck actually go up the head. They all don't go out towards the arms. So often, spinal problems might start off with symptoms of headaches and spasm, and even ear pain can be a manifestation of a spine problem. Degenerative disc disease is a common condition that affects every single human being on this planet. Basically, the discs are like brake pads. They actually provide padding between the two vertebral bodies, basically padding between two bones. And over time, what happens is this padding, based on how much twisting, loading, straining you're doing, these pads crack, wear, and sometimes actually herniate, meaning pieces of it fracture off. So that is actually degeneration of the discs. The issue is that depending on how fast or under what vector direction these items fracture, they can cause a lot of problems. If they fracture off towards the nerve or the spinal cord, it could be a situation that can only be corrected by surgery. CRPS is a horrible disease and a horrible problem. Basically what happens is you have nerves that send signal from your brain to your arms or brain to your legs. Now what happens a lot of times with an injury is that that nerve becomes stretched. So it's like taking a wire and pulling it hard enough so that the insulation cracks. The way the patient actually knows this or understands this is, one, the patient experiences pain. And what's particularly true about complex regional pain syndrome is that the patient actually has a lot of symptoms of dysfunction of the nerve. The arm swells up because the brain is not able to control the blood flow. The bones change for the same reason. The ligaments tighten up and patients often get deformity. Because of the short circuit and the misfiring of the pain signals, patients have weird sensations, which we call allodynia, where you touch it and it gives you a hypersensitivity response. You can even touch the hair on the skin and that actually goes back to the brain and is interpreted by pain. So complex regional pain syndrome is an assortment of findings basically that happens when a nerve is damaged. I'm Dr. Ashwini Sharan. My mission at Jefferson is to improve lives.